I'm based, I schooled here, University of Benin, and then I traveled, and I'm based in Canada. I'm a consultant pediatrician and neonatologist is my special interest. One of the roles I do is to go around teaching CPR, because where I live in Canada, the mandate is for everybody to be able to do CPR. That's the cardiopulmonary resuscitation. Everybody, child, adult, everyone is to learn it. So the concept was, why am I teaching in Canada when I should be teaching at home where I was trained? So that's how the whole thing started. So I'm hoping that today we'll be able to learn how to revive, what to do when you see somebody have a cardiac arrest. And with cardiac arrest, we mean when somebody's heart is not beating. So if their heart stops beating for any cause, they lose blood flow to the brain, and then they collapse. And when they collapse, if you don't do anything, they will die. If you do something, you give them 3 times the chance of surviving. So the mandate is for you not to watch, but to be able to do something, and that's what we're hoping you can learn today. It's supposed to be very informal, please, so stop and ask. I have lovely facilitators. They are medical students from Luth. They are awesome. Please stand up and be acknowledged. Yes. Thank you. They are going to be physicians by next year, by the grace of God. So they're just awesome facilitators. Thank you. So this is an informal setting. Please stop us, ask questions. We want hands-on. We want you to practice well. Okay. So the first thing is, how do you recognize somebody who has cardiac arrest? It's to be able to recognize them. So if you see somebody slump on the floor, how can you recognize that the person has cardiac arrest? The first thing is that they will be unresponsive. They won't answer to their name. 2 is that they will not be breathing. And 3 is that they will have no pulse. So I'll just demonstrate what to do. I'll just do an overview first of what to do when every age, every race, everyone can have cardiac arrest. And when there's cardiac arrest, it means the person is not responsive, they are not breathing, and they have no pulse. Okay, so that's cardiac arrest. That means their heart has stopped beating, and you have to act fast. Because when it happens, there's no flow of blood to the brain, and then they fall, lose consciousness, and if you don't act, within minutes, the person dies. That's where you hear of people who have slumped and die. It's cardiac arrest. Because somehow something has happened that their heart is no longer pumping. There's no oxygen or blood to the head or to the heart. They lose consciousness right away, they slump, and if you don't do anything, the person dies. So what we're trying to do is encourage everybody to at least know what to do to start something, because you triple the chance of somebody surviving just by doing cardiac compression. So it's so important to do something. So if you see somebody who falls on the floor, the first thing you want to make sure is that you are safe, because you have to be safe. You are of no use to somebody if you put yourself in danger. So you look around the surrounding, make sure it's safe. So if the person is on the road and it's a busy road, you won't just run to the road. You'll find a way to move the person to a safe place. If there's fire around, make sure you move the person away. So you want to make sure the area is safe. So when you run to the person, look around, make sure it's safe. That's the first thing you want to do. Then you want to see whether the person is just tired and is sleeping, or you want to make sure the person is not responsive. So you run to the person and shout, "Are you okay? Hello? Are you okay?" And there's no breathing. Next thing you want to do is call for help. All these things is happening quickly. You call for help. You say, "Oh, please call," in Canada it's call 911, or bring the AED. But here, you just call, you just shout, "Please help, come and help me." So that at least somebody else can come to help you. So you call for help, And immediately after that, you want to look at the breathing to see whether the person is breathing or they have a pulse. And you look, and you're looking for chest rise, because when you breathe, your chest moves up and down. So you look quickly for chest rise, and then you want to feel for a pulse. This is, everybody has to be able to do this. To feel for a pulse, you look at the cartilage, the trachea, the cartilage. You put your hand on the cartilage, then just move it to the side. That small dip, that's where the pulse is. So you can do that and feel your pulse. Okay, just use your 2 or 3 hands at the side. Don't stretch your neck too much like this, and you can feel your pulse. So you look for the trachea, that's the middle windpipe, then to the side, just the groove at the side, and that's where the pulse is. This is the carotid pulse. Okay, that's the easiest place. In children, it's in the hand. You just do it on one side. You do it on one side, but just on one side. The side, any side, but the side closest to you. Okay? If there's no pulse, don't keep on feeling. If there's no pulse, there's no pulse. Don't second guess yourself. There's no breathing, and immediately you want to do chest compression. So you want to, the nipple line, you expose the person, the nipple line, just below the lower part of the breastbone, you put your fist here, and your second hand, and you start to, your elbow should be straight, and you push hard and fast. And you want to do at a rate of 100 to 120 per minute. In my head, we sing, staying alive, the Bee Gees song. That will give you the rhythm. Staying in your head, so that gives you the rhythm, and that goes to 100 to 120 per minute. And so you keep on, you do 30, and then you want to breathe for the person. To breathe for the person, you open up the airway and you breathe, okay? Before COVID, we used to encourage breathing, but we don't encourage mouth to mouth anymore. If you don't have anything, you just keep on doing the cardiac compression. If it's a close family member, you do mouth to mouth. If you have, there are things we have, like this, I carry it all around. It's a single shield, or you can have this pocket mask, and it's a one-way valve. I have it in my pocket everywhere, and you just blow to give them breaths, okay? So that's what you do if you have it. If not, just keep on doing. It's better to do cardiac compression than not to do anything, because this, you're saving the person's life. And what you're doing is that you're pumping blood for the person. Because the heart is not working, you are doing the heart work by pumping blood around the body while you're getting help. So this is what you do. If you have this, you use it. If not, just continue to do cardiac compression till when you get help, okay? And you continue to do this. Where in Canada, sorry, that's where I have to refer to, is we have the AEDs, and I didn't realize you didn't have. That is standard of care now. Everywhere should have this. Every church, every school, mall, shops, you should have this. Sports arena is standard of care. Because one of the more common causes of cardiac arrest is when the electrical pulses in the heart don't work. It's an arrhythmia, irregular heart. So the heart doesn't pump well. So this just shocks the heart back into normal rhythm. This is life and death for many people. If you don't have this, the person dies. Okay, so this is now standard of care. And so when we're calling for help, like in Canada, we say call 911, and we say bring the AED, because everywhere should have AED. Okay, everywhere should have AED. So we will practice how to use the AED. And everybody should know how to use the AED. You don't have to be medical to know how to use the AED. So it has 2 pads. And one you put just the collarbone, below the collarbone in one. And the second part near the nipple Okay. And all you do is turn it on.
Adult patient.
And you follow the instructions.
Press pads firmly on skin. Do not patient. Analyzing heart rhythm. Shock advised.
And then all you do is shock.
Do not touch the patient.
And before
Clear.
yes, so you say, you make sure everybody is clear. You shout, oh, I'm clear, everybody clear, and then you shock.
Shock delivered.
And once you shock, you start doing, you do your compressions again. And many times, if it's just the irregular heart rate, the heart becomes back in rhythm and the person is alive. You know, so you just keep on till when it tells you that it's not, you continue. Okay. Staying alive.
30. Give 2 breaths.
So it tells you what to do. And you give 2 breaths. And then you continue.
10. 20.
And basically this is the easiest way, and you save lives just for this procedure. Okay? All right, so we'll practice now. Okay? What I'd like us to practice is how to, when you go to the scene, what to do and how to feel the pulse. Then we'll talk about the chest compression. I'll talk about the proper technique. So let's just group, maybe a group of 2, and we'll have a practice. Any question, but then you start breathing for the person. Okay, yes. But you want to keep on, you want to be alert, because sometimes there's a pulse and then suddenly there's no pulse. You keep on monitoring. The other thing about breathing is that sometimes somebody has an irregular breath, if they're gasping, that's not proper breathing. So make sure it's proper breathing before you say this person, yes, is yes. If they're gasping, that's not proper breathing. You treat them as if they're not breathing at all. Okay. And this is for everybody. You don't have to, we're trying to teach everybody, children, adults, elderly, everybody should know how to do CPR, because it's a basic life to be able to, it's a way to revive somebody. Okay? Okay. Yes.
How do one know, like you talked about the ribs injuries and the rest, how do one know the amount of pressure to be exerted without breaking the ribs?
Yes. It's unlikely to break the ribs. Guys with broken ribs, than good ribs and the person dies. Okay. But with the technique, you're unlikely to break the, I'll go into the depth properly. I will show you what to do properly, yes. And it's 1/3 anterior posterior. It's about 5 centimeters or 2 inches deep that you want to go. Okay, but we'll practice it. Okay, yes. You can't, it's very unlikely that you can break the ribs if you have the correct position. If you go and do here, then yes, you can damage. If you go here, you can damage, but it's the center, it's unlikely that you'll break, yes. It's more likely that you're not pressing hard enough, that you're pressing too hard to break the rib. Yes. But don't even worry about that. Just do that. It's better for the person to be alive with some broken ribs than you are not doing it at all. Okay. Yes.
What about the lady that is busted?
Yes. Well, still, it's the same. Yes. The only difference is pregnancy. With that, we try and move the womb, and we'll go to that. There's a way we'll push the womb a little bit to the side. Okay, but the landmark for chest compression is the same. Whether you're big, small, it's the same. Okay, for children, we'll talk about the children a little bit later. Okay, so we'll practice.
Just like she said, it's likely that the lady will be wearing a brazier.
Yes, you have to remove, you have to take everything off. You want the bare chest, because this AED, this defibrillator, it has to be on the bare skin. It has to be on the bare skin. Okay, so you try and remove, yes, just tear the clothing off and then go for chest. Okay. AED stands for Automated External Defibrillator.
Defibrillator.
Yes, AED, yes. Yes. In the past, it used to be ABC, but now it is CAB. So it's cardiac compression, airway, breathing, then we do the AEDs. So it's CAB, instead of, before it used to be ABC, but it's CAB. So it's chest compressions, which is cardiac compressions, then the airway, then the breathing. And we want you really by 10 seconds to be already starting chest compression. So what we practice should be done very, very quickly. By the time you are checking the pulse, really by 10 seconds, 10, 15 seconds at the max, you should be already getting ready to do your chest compressions, because that's the most important. Because in cardiac arrest, the heart is not pumping. So there is no blood going to the brain and to the vital organs. So that's why they lose consciousness. So by doing chest compressions, you are beating the heart, you are making the heart pump blood. So you are pumping blood around the body, especially to the brain, for the person who has fallen. So the quicker you do it, the better for the patient or for the victim. And while you are doing it, you don't want to stop and, stop. You want to continue. And it's very hard. You will see that it's hard. Every 2 minutes, if possible, you rotate. By the time, hopefully, you will have had help. And once you're getting tired, you make sure the person comes smoothly and takes over. So you want to continue because you are pumping blood. The victim is relying on you to work, to function as a heart for them. Pump the heart for them. And that's what you're going to do. So I'll just demonstrate about the cardiac compression. So the landmark is the chest bone, the sternum, the middle, the chest bone. And the nipple, you want to go on the lower part of the breastbone, that's the chest bone, the center of the chest. Okay, so especially for men, for women it's a little bit hard to go with their nipple line, but for men it's easy, around the nipple line, just below. If you imagine a line between both nipples, just below is where you want to put your hand, or just the center of the chest, the middle of the breastbone. You don't want to go too low, but you want to go at the center of the chest. So your hand is the heel of your hand in the center of the chest, and your second hand should be on top of the first hand, and you lock it like this. And then your elbows should be straight, your shoulder should be straight over your hand, and then you press. And you go deep, 1/3 the anterior posterior, which works out to be about 2 inches deep. or 5 centimeters deep. It's hard to think about. You're not measuring, but that's just an idea. About 1/3 the anterior posterior diameter. And then you want to do as a rate of 100 to 120 per minute. And it's 30 compressions, then you do 2 breaths. Then you do 30 compressions and you do 2 breaths. If you are not comfortable doing 2 breaths or you don't have any cover, just continue to do the chest compressions, okay? In my mind, I tend to sing Staying Alive. That's how I just get my rhythm. Staying alive, staying alive. Yeah, but you just, once you get your rhythm, however you do, this is what you want to continue. So your arms, your elbows should be straight. Okay? And it's 1, 2, 3, 4, 5, 22, 23, 24, 25, 27, 28, 29, 30. Then you do 2 breaths. If you are the only one, you do 2 breaths. Then you continue. 1, 2, 3, 4, 5, 6. Okay, you try to, when you press, you always have to recoil. You have to have a chest recoil. So you raise your hand. You don't leave, but yes, you want to have a chest recoil so that the heart can be full. Okay, it helps with the filling of the heart. So you're just not doing this. You're doing 1, 2. You're coming up, down and up, down and up. That's how you do. Okay, but you want to do at a faster rate. So you push hard and fast. And this is what you do. And it's hard work. So that's why it's advised every 2 minutes you rotate. And this is the rhythm. It's 100 to 120 per minute. So 30 to 2. And by the time somebody comes, the person takes over this side. Okay? And so, can I have help? Okay. The breathing passage. Because if you're going to start to bag this way, and the head is this, you're obstructing the airway. Okay? Air, no matter what you put, air will not go to the lungs. But when you open up the airway, the head, you lift the head. So you tilt the head and lift the chin. Okay? That is the way to open up the airway. And this is really important in children. We'll talk about children later. And then you want to, if you have a pocket mask, I'll still talk about it. Usually the narrow part, most of the face masks, they have a narrow path. That's the sharp part. That goes over the nose. Okay, over the nose. So that sharp part is over the nose. And this is the way. But for this bag, sorry. So it's over the nose. So head tilt, chin lift. Okay. And how you want to do it, we'll do it individually in the small groups. Your 2 fingers, your thumb and the index finger, your second finger, should be like a C, okay, to press it, and the rest of your arm should be E. So it's like E and C, C-E. That's the way to hold it. And then you breathe. Okay? And that's what you do. Okay? Either that, or if you have your pocket mask, it's the same, and you breathe. And you look for chest rise. Okay? That's the way to. So when you're 2, when you have more help, someone is doing chest compressions, somebody is breathing. Okay? So you coordinate 30 to 2. 30 to 2. Okay? For the adults. Any questions? Have you guys seen this? No? No? Okay. Okay. Or if you are doing mouth to mouth, it's 30 to 2. For children, you put your mouth over the mouth and the nose. For adults, it's just over the mouth. For children, because their mouth is small, it's over the mouth and the nose. But we'll talk about children separately. Okay, all right. Any questions for that? Did you all practice cardiac chest compressions? Okay. Oh, you haven't finished? Okay. So we can do that and incorporate the breathing. Okay. Okay, so it's to be nice to practice how to use this. Okay.
This one is a tool that we must use this.
Yes, you must. Yes, you must. This is, this is usually when you have help come. Most places, because the cardiac arrest can happen anywhere, in the mall, in the shop, anywhere. On the road, most people don't have this. So we're hoping people can have this, or you do mouth to mouth if it's a relative of yours, or you can do a face shield. Find somewhere, and like a shield for yourself, or if not, just don't do it and do the cardiac compression. But this is more for when you have help and you're going to the ambulance. They should have this. In hospitals, they must have this. The ambulance should have this as well. Yes. But for the everyday, you don't expect to have this in your purse, no. Yeah, but it would be nice just to practice. In case the ambulance comes, because I know in Lagos State, they have ambulances. If they come, and because you will need to rotate with them, when they know you can do CPR, that's very nice. But you want to put the person on the floor. Because if you are doing chest compression on the bed, you are going to be pressing on the bed. It's not going to get to the heart. So you put the person, but you need to have help to move the person. But already if it's outside and the person is on the floor, it's already a hard surface. So you raise, this is what you do. Okay, you raise, okay? Yes, so it's the head, tilt, chin lift. So you push the head like this. Okay, if there is a risk of head injury, you are going to be very careful. You don't just do this, because if there's a spinal injury, you are going to make it worse. So what you want to do is move the jaw. It's called jaw thrust. You move the jaw. This mannequin, this dummy is not the good. Yes, you move the jaw. It's gentle. It's called a jaw thrust. Instead of moving the whole head like this, if there's a spinal. So if you think there's a spinal injury, then you want to be careful with the spine. It's called a jaw thrust. You're just like the jawbone, you are moving it forward. That's what you're doing. Okay? But this one, if it's just the regular, you tilt the head and lift the chin. In doing that, you're moving the tongue, you're moving it away from the airway, because when it's like the tongue is down, blocking the airway. So by doing this, the tongue moves so that the airway is open. That's the risk. So it's just easy like this.
Just place our hand.
Yes, gently. Yes, you gently do this, and then I'll do the. Thank you.
This?
Yes, thank you. So this is the mask. Okay, so like this. So my hand is here on the chin, and the one head is like this. Then you continue your chest compression. You do 30. You do 30. That's how you do.
We do that continuously.
So when you get help?
Is it until we feel the pulse or until we get help?
When you are by yourself, till you get help. Okay, till you get help.
When it's only me, I'll just continue.
Till when you get help. That's why it's important.
I will try to feel the pulse.
Yes, there's no, unless help is coming. Okay, you just continue. Yes, but that's why it's important to call for help before you start. Yes, so that help is coming, because you can't do this for very long. It's very tiring. Okay, so you call for help. So after checking the safety and you're tapping and you know it's so important, call 911. You call help. You ask for help so that people will come to help you. Okay, because it's hard. If not, there's no point. You just continue to when your help comes. Okay? Any questions? Yes.
My question is, I want to ask, if someone collapses and we check the pulse,
Yes.
and the breathing is not there,
Yes. So if there's a pulse,
yes, there's no breathing.
yes, and all you need to do is breathe for the person. Yes. So there's a pulse, you don't need to do chest compression if there's a pulse, and it's a good pulse. If it's a very weak pulse and it's faint, then you do chest compression, because sooner or later the pulse will go. But if it's a good pulse you're feeling, you don't need to do chest compression because the heart is pumping. Chest compression, you're pumping the heart. So if the heart already is pumping, you feel a pulse. So when you feel a pulse, it means the heart is pumping. So you don't need to pump for the heart, but you can breathe for the person. Like abroad in Canada, there's opioid, like the opioid, there's a whole epidemic in the States, opioid addiction, when they take fentanyl and morphine as an addiction. That one, the heart is usually there to start off with the pulse, but they are not breathing. So what you want to do is just breathe for them until when you get the reversal, but we're not going to really talk about it. It's not that, but you breathe for the person. So all you're doing is breathing for the person. Okay, and you monitor. Mm-hmm.
Both the pulse and the breathing is not there.
Yes, then that's what. If there's no pulse and breathing, that's when you do the chest compression. That means you're saying this person has cardiac arrest. Okay? Okay, that means there's cardiac arrest. Okay? Okay. Any other question? So we recap. Let me just summarize. The importance of this is to look for, if somebody collapses, is to see, is this person in cardiac arrest? Cardiac arrest means the heart is not pumping. When the heart is not pumping, the blood does not go to the head and the vital organs, the person collapses. So you want to see, okay, is this person in cardiac arrest? So is the heart not pumping? So you go, make sure you are safe, make sure everywhere is safe. Try and touch, oh, Mr. This, hello, sir, hello, quickly, and then call for help, call 911 and bring the AED, because generally there should be an AED around. Bring the AED, call for help, and then you start, call for help. Then you see, is there breathing? This should happen very quickly. Is the person breathing? So is the chest moving up and down? If it's not moving, then check for the pulse. Okay? The pulse, just to the side. If there's no pulse, you start chest compression. Okay? And you start 30 to 2, 30 to 2. Hopefully by then, the AED is here. And then you put the AED and you shock the person. Because one of the commonest causes of cardiac arrest is an arrhythmia, which is an irregular heart. Because the heart is usually wired. It's the pumping of the heart is by electrical impulse. And many times it just goes haywire. And then the heart is not pumping. It just is flabby. It's not pumping much. And so what you want to do is shock the heart to get it back in normal rhythm. It works, it's like a miracle. It works well. And if you don't do it, the person dies. It works really well. So when you are doing this, then you get the AED. And so that's what we'll talk about the AED next. So I'll just take this. So AED is a defibrillator. This is for everybody to use. Everybody. It's called an automated external defibrillator. So it's automatic. You don't need to do much. In the hospital, we don't tend to use this. We use the proper defibrillator. Actually, this is available as well. And so this is really to shock the heart, because one of the commonest causes of somebody collapsing, when you hear people slumped and died, is because of arrhythmia. They are running. You've heard about, there's this famous footballer, is it Sorensen, who collapsed, collapsed, but they shocked his heart and he was fine. Or if you hear people falling, and it's usually arrhythmia, irregular heartbeat. So this is to shock the heart back into normal rhythm, and it works so well. So what you want to do is just turn it on and it tells you what to do.
If the patient is a child, press the child button.
Okay, there's a child button and there are child.
From the patient's chest.
Okay.
Remove packet and apply pads onto patient. Press pads firmly on skin.
Okay, so there are two. You do one.
Apply pads as shown
On here.
in the pictures. Press pads firmly on skin. Do not touch the patient.
Okay.
Analyzing.
So now it's checking for the rhythm, whether there's an irregular heartbeat. So you,
Analyzing.
so you hold off
Shock advised.
and they advise you to shock.
Do not touch the patient.
Okay, so what we normally say, all clear, to make sure, because if you touch, you will get shocked. And you yourself can have an arrhythmia. Yeah, so that's why we say all clear, and I'm clear, all clear, and then you still look to make sure somebody is not touching, and then you press the shock.
Shock delivered.
And then once the shock is delivered,
CPR.
you're not checking for pulse, you start your chest compression, just in case. Okay.
20. 30. Give 2 breath.
It's telling you what to do. So you do this for 2 minutes, and usually it tells you whether the heart is in rhythm or not.
20.
It counts for you.
30. Give 2 breath.
And you do 2 breaths. And then you continue till when, then you check the pulse. Many times the pulse is back, just by the shock. Okay? I'm hoping that eventually everywhere will have this. Okay. We're hoping, okay. Because everywhere, every church, every school, every sports facility, the malls, they should have this.
20.
Because it saves lives. Okay, so we'll practice. We'll practice everything till the shock. Everything, including the shock, okay? Has anybody used this before? No? No.
About touch while he says why it's not clear.
Yes.
Making contact.
Yeah.
And you shocked.
You'll get electrocuted. It's shock. It's real shock.
My question is, when we pressed it now
Yes.
and it says shock
Yes.
and then you start pumping,
Yes.
I was thinking that you would disconnect.
No, because many times the person may need about 2 or 3 shocks. Many people just need one, but many also need more than one shock.
So how would you go back to shock?
It tells you, the machine, that's the beauty about this. It takes over, it becomes in charge. It tells you how you are doing chest compression, when to breathe, and then it analyzes after about 2 minutes. And then it tells you whether it needs to be shocked or not. Many times the shock is not advisable. That means the heart is in rhythm. Then you check the pulse. And the child, many times the person is in rhythm. Responsiveness, the person dies. Yeah. Okay.
So this shock now will tell you when to touch the person.
Yes, no, when it's about to shock, you don't touch because you will get shocked and you will get electrocuted.
It will tell you when to touch. I mean.
Yes, it will tell you when not to touch. Yes, because then it's flashing before you, it flashes for you. Before you press that, you have to make sure nobody, because you are the one going to shock the person. So before you press that, you make sure. So what normally we say is, I'm clear, all clear. So you make sure, because you have to remind yourself that you are clear. So all clear, I'm clear. You remind yourself and you make sure everybody, but not only saying that, you are looking around. As physicians, usually we're the team leaders. So we usually call it. But whoever got there first should just take charge. Make sure nobody is touching. And then you press the shock. But if somebody is touching, the person gets shocked. It's pointless. Then it's a burden. 2 people now.
So they have this in the small one.
Yeah, no, this one is training one. I just use it for training. But every device is similar to this. It's just so that for training, we're not shocking ourselves.
So they don't have small ones that they can put inside bag and go. It's when you need somebody.
Okay, no, there are no, you know, there are many ones, there are small ones, but it's not really,
Like tents now,
like there's this mini one, but this is a training one, but usually they are bigger because they are to shock people. Yeah, there's a mini one, but this is a training one. But usually the smallest is about this size. It's about this size. But yes, but it should not be in your pocket. It should be,
your bag now.
no, it shouldn't be in your bag. This one for breathing can be in your bag, but this one should be in the facility. It should be in a school. It should be in a church, in the mall, in an office where there are many people. That's where it should be. Like in Canada, it's everywhere. Everywhere should have this. That's standard of care. So that's why when you're calling for help, you're calling them, bring the AED. So you're saying call 911 and bring the AED. Everywhere should have this. Like the malls have this. Schools, gyms, they all have this. It's standard of care because it changes lives. It revives people.
Okay, let me ask you a question. If you don't have this thing now, and somebody has tents, and can we use the tents to shock the person?
Use what?
Tents.
What's the tent?
This tent that they used to put.
Oh no, thank you. No, you don't do, no.
To awaken the nerves.
No, you don't, no, you don't, because it's the heart, no. Because this is a specialized one. Like for children, the pads are different. They are smaller pads. And it gives a smaller shock. You don't use the adult pads for the children. Or if like this one has for the child, a button for the child, so it transmits, so it has only one pad, but it transmits the amount of current to go. So you can't even use the adult current for a child. Yes. So no, you shouldn't even, it should be in the facility, and you don't try to shock, no, it's specialized. Okay. But in any big facility, this should be there, to be honest with you. This is so important. Yes. I didn't come with any real one, I mean, because it's facility, these are just the training one. I should have just left it, but I didn't realize, yeah. Yes. I'm sorry.
I'm saying maybe the medical people.
Yes.
The students are coming and the doctors.
Yes.
Generally will understand.
Yes.
Clear or clear.
Okay.
I'm thinking as a typical Nigerian.
Yes.
When you are saying I am cleared or clear.
Yes. You just say, okay, you say clear. Then you have to move their hand. You tell them you're going to be shocked, you know.
Or somebody from nowhere is just coming.
Okay. Then yes. No, so you have to make sure. And that's why crowd control is important as well. You want to make sure that not many people, because it's of no use, you know, just clear the scene. And then, but the person pressing the button, the shock button, has to make sure, because if not, you'll have two people on your hand, because the person will become unconscious. The person, you will shock the person.
So I'm clear. Yeah, the next, you don't say all clear.
You look. I'm clear. All clear. Make sure, and then you press. But as you're pressing, make sure nobody's touching the patient.
Revive the one that is on the floor, will not come back to the one that touched.
That's the problem. That's the problem. That's the problem. Yes. I'm hoping that you guys can advocate to get this. Yes, for wherever you should advocate for it. Wherever office you are, wherever school you are, just. I hope they said. It didn't even cross my mind to yes. It did. It's anywhere from $500 to $1,000.
Then we can order it for through you. Moving one to the within church.
Yeah, it's honestly, it's something that has to be advocated.
When are you going back?
On Saturday, at the grace of God. If I had known, but I just came with the training once. I didn't even. I'm sure they sell it here though. I'm sure they must sell it here.
The problem is buying it here.
Yes.
That you can buy one,
Yes.
and the day you want to use it,
Yeah.
you find out that it's not working.
Oh, you test it?
I'm saying that you have tested it. Then I show you okay, it's fine, you pay for it. And by the day you want it, exactly that day you want to use it, you find out that it's a fake one. So don't worry, by the time you're going back, you will ask someone to buy for us.
Okay. It didn't even occur to me that it won't be available here. So I just came with the training. Yes. But it's supposed to be. So please, everywhere you guys are, please advocate for an AED. Okay.
Okay, stop AED.
AED is automated external defibrillator. It's automatic, that's why. Okay, so in the sides. Between the shoulder and the elbow, in between, that's where you feel the pulse, because their head is usually quite big. So it's hard to feel for the carotid pulses. You feel for the brachial pulses, so it's for the arm pulses. So between the elbow and the shoulder, halfway, you put 2 fingers and you feel the pulse in children. So that's one difference. So you can please feel it on your own hand and see where. You can feel it and know where to feel. Halfway between shoulder and elbow. Use 2 fingers and you feel you feel a pulse there. That's what you do for babies. The other thing for babies is that they need more breathing. So when you have help, when you're by yourself, you do 30 to 2, like in adults. But for babies, when you have help and there's somebody else, you do 15 to 2. So in that case, you're giving more breaths. So instead of 30 to 2, you do 15 to 2. And you can only do that though when somebody else comes to help you. So as one person, you do 30 to 2, whether it's adults or children. But when you have 2 people, in adults, you still do 30 to 2, but in babies, you do 15 to 2. Okay, so that's the difference. I know the first session is almost over. I wanted to show you quickly about choking, because I think it's important you know what to do when somebody is choking. So we'll start with the babies or children, because they tend to choke more. And I'll just sit down and demonstrate what to do. So if a child is choking, you see them, you will know because they are changing color, they are not making noises, and you know they are choking. So you take the child on your arm, you put one leg, you turn them face down, the head is lower down, and you tap. So if you're putting them on your thigh, you use your right hand, and you do 5 slaps. So 1, 2, 3, 4, 5. The head is a little bit tilted. Then you turn the baby over, and just like the CPR, you do 5. And then you turn over, and you turn over, and by then usually the thing comes out. So you slap 5 firm, and you're unlikely to break a rib. And you turn over. If you don't, the person chokes. So you do this, and then turn over, and you do the cardiac compression 5 times. Turn over. You do this.
So it's 5,
5. And each time you look and see whether there's the breathing.
We need to look there.
Usually you're trying to explain, yes, but if they lose consciousness, then you start your CPR. Because choking, you want to try and expel it. And if they either recover or they lose consciousness, they become limp, then you put them down and start doing CPR. And for babies, the CPR is a bit different. Because they are too small for your whole hand, you are doing 2 fingers at the side, the nipple, just below the nipple line, 2 fingers, that's how you're doing. Or 2 fingers up here, that's how you do, okay? The depth is 1/3 the anterior posterior, that's back and forth, 1/3, around 4 inches. Okay, same rate, or you do this for children. If they're big enough, older than 8, then you do the hand. But you can't do this because it's too big. Okay, so you do this or you do this. Okay, so if they are choking, they expel it. If they lose consciousness, you start CPR. And as you're pressing, you are likely to let it go. For adults, for adults, for the choking, I won't do it on you. Okay. So one hand you make a fist. Your other hand, first of all, you locate the navel because you want it above the navel. You put your hand with the fist around the waist. The second hand here, and you do a big, I won't do it on you, a big push towards up and down. Just sudden, you push in because
How many times?
1 or 2, the hard ones, yes, big hard ones, upwards, in and upwards, sorry, okay? Big ones, and you are likely to expel it. If they lose consciousness, you put them down and do CPR. For pregnant women, you can't do this, so you just press on their chest. Okay, that's not ideal. but you try, okay? If not, when they lose if they lose consciousness, you do CPR. Yeah. Okay. So those are the yes. So recap. Sorry.
When we check the pulse, you said it's from the arm.
No, that's for the babies. Yes. So between the shoulder and the elbow, halfway through inside. If you feel it, you have a pulse there. Okay, halfway through. You feel it. You use 2 or 3 fingers. That's the brachial pulse. So in babies, it's very strong in babies. Okay, that's where you feel for the babies. Okay, so just a few things to recap. I'll just do a few emergencies. So heart attack, I had said that early. Heart attack, when there's poor flow to the heart, they have chest pain. They have chest pain, tightness, radiating to the arm. If you have aspirin, give them aspirin. If you have aspirin at home, baby aspirin, give them aspirin, and you take them to the hospital. But you monitor them because they are likely to go to cardiac arrest because the heart muscle dies or it becomes irregular. So if somebody has chest pain and you're around, if you can get aspirin, don't leave them and go and look for aspirin. If possible, get somebody to get aspirin. Give them aspirin, 2 or 3 of the baby aspirin, and try and get them to the hospital as soon as possible. Okay, so that's heart attack. Every 3 seconds in the world, somebody has a heart attack. Every 3 seconds in the world, somebody has a stroke. To recognize a stroke, the face is weak. One side is usually weak. Their arms, you tell them to raise their arms are weak. Their speech is slurred, so it's fast. So F for face is weak. A for the arms, you tell them to raise their arms, they can't. 1 hand or 2 arms, they are weak. Then ask them to speak their slurred speech or their jumbling. Then you know that's a stroke. And the T is for you to get to the hospital. Because usually, like in Canada, I'm sorry I'm always using, you have to get them within 4 to 5 hours because they need to do the procedure to remove the clot. So here, I don't know what it is, but that is to remind you that the time is important because every time the brain cells are dying. Okay, so fast is the mnemonic. But for you and me, please, face, if anybody's face is drooping, tell them to raise their arm. If they can't raise their arm, that person is having a stroke or their speech is slurred. Yeah, and you know they don't normally speak that way. That is a stroke. Take them to the hospital as soon as possible. Then EpiPen. Sorry, I have so much to say. EpiPen is allergy. I don't know whether you've seen this before. It's allergy. It's epinephrine. So when you're allergic to something, like some people are allergic to nuts or to fish, or this is an injection. Usually for children, I'm a pediatrician, so I'm referring to children. They always carry it in their pocket. They have a pack. They must always carry it. And if they get into something they're allergic to, this is what you do. You just throw their clothes and it's fine. Okay, so always carry this. Regardless of what the allergy is, this stops because with allergy you choke. Your throat swells, your eyes swells, and you can have cardiac arrest. So make sure they are breathing, but get epi as soon as possible. Through their clothes, you just you stick it. And it's done. A needle comes out and gives it to them, and it's done. Okay, so.
Hi guys, my name is Ayomide. I attended the CPR learning, which I learned a lot, things I didn't know of, how to resuscitate people back if they collapse. So a lot for both the adults and the babies, and I hope you learn and put it to practice because I am going to do that. Thank you.
Okay, my name is Engineer Ogeva. I'm also a pastor here. I'm very excited to be part of this training today, the cardiopulmonary resuscitation, CPR. I'm very, very excited because over time we see a lot of incidences that we may have been able to help, but because we don't have any idea on what to do at that instant, a lot of souls have gone. So the training we have received today will enable us to be able to be to act as a first responder in instances of, cardiac arrest. So we want to thank the facilitator, want to express our gratitude to everyone who have, taken our time to come and teach us this CPR. We appreciate them. God bless them. Thank you.
Go. Okay, good. Hi, my name is Daudi Tiwa. I'm one of the facilitators for today. We all taught and learned about CPR, how to do cardiopulmonary resuscitation. This is what everybody should know how to do. First responders everywhere. Anybody slump beside you, you should know what to do, like how to start compressing, how to all that you need to know about it, and also to know that there are gaps to be filled in our part of this country, basically, like basic things like what's they say? Basic things like maths, what to do, and how to teach others. How to teach others. It's good to have the basic knowledge and how to teach others. So you can teach others, teach your family, because it's good to know these things. But what about people around you? Just in case anybody can fall victim, anybody can fall, anybody can have an arrest. So just to know what to do. Thank you. Thanks for that. As a church should have a AED. It's called automated external defibrillator. The church should have this. All schools in Nigeria should have. All churches in Nigeria should have. All facility offices where a lot of people are should have it. It's very essential. It's very essential. It helps to shock the heart back to rhythm. It's very essential. And everybody should know how to do the CPR. More trainings on cardiopulmonary resuscitation should be done in churches and basic places, so everybody knows how to do CPR. Thank you.
Hi, I'm Dr. Anne Webube. I'm a consultant pediatrician and neonatologist. I practice in Canada, Ontario, Canada. I was here for the CPR course, which was very successful. We went through just the basic life support of what to do with scenario of cardiac arrest, and it was very successful. Everybody, it was hands-on, everybody practiced, and we were more confident in administering cardio. It was good. The venue was awesome. Everyone was, very interested in learning, and I'm hoping that the information will be disseminated so that everyone around will be able to know what to do in case an event of any cardiac arrest. Thank you.